Hey everyone, I'm Dr. Jackie. I'm a child and adolescent psychiatrist. I make videos about psychiatry training as well as make commentary on how mental illness is portrayed in the media. If that's interesting to you, like and subscribe and join the team. As you guys might have noticed, I haven't posted in a while, and that's largely due to the mental health crisis that I'm sure everybody is aware of. I've had to prioritize caring for my patients and their families as well as my own self-care. I talk about this all the time to make sure that you're taking care of yourself first and that you have something left to give. This allows you to be able to do your job well, or at least the best of your ability, without completely burning out. I always appreciate all the comments and questions that you leave on my videos, and today's video I just want to go down the list and see how many of these I can actually respond to. Hi Dr. Jackie, I'm a US Caribbean med student with essentially non-existent research opportunities, support, etc. I've joined the APA back in February to show commitment to the specialty early on. Do you have any suggestions or routes I can take to make myself competitive? Psychiatry is an ever-growing field. Unfortunately, the amount of spots that are available aren't always matching the level of interest in any given specialty. I can appreciate how frustrating that is to feel like you don't have any mentors accessible to you, since even though there is a lot of interest now, it hasn't been the biggest field. And I had the same experience as a med student where I felt like I didn't have any mentors, and that was the reason why I started this YouTube channel, so that other people wouldn't feel like their interest is something so unique or rare. I think that you can see that there's definitely a lot of interest in psychiatry now, and now the question really is, how do I stand out as an applicant? Joining the national organizations like APA, if you're interested in child psychiatry, there's ACAP, is really helpful because they have a lot of training resources on their websites, and I can link it in the description box below. Take a look at everything that they post about, and looking at when the conferences are would be really helpful, especially since the pandemic, a lot of them have been virtual, and so you have a lot of access to resources that I think was a format that I would have never been able to utilize because it just simply didn't exist back when I was in med school. In addition, it definitely helps with the feeling that there's a community out there and that you're not alone in your interest in psychiatry, especially if you're feeling like there aren't any people accessible to you where you're at right now. At specific conferences, they often have lectures or meetings specifically for people who are interested in the field. Making a note of that and attending those would be really helpful because you're going to be surrounded by people who really do want to help you move forward in your career. I know that was really helpful for myself when I was in your position right now. Once you start clinicals and you are then surrounded or have access to people who are mental health providers, ask them if they are publishing anything or have any scholarly activity options for you. Everyone is always looking for an eager med student, and it is very fun to work with you all when you're interested in pursuing what we do as a career. I notice a lot of you put at the beginning of your comments that you're not sure if I'll ever see it, or I hope you see my comment and are able to respond. In general, I'm pretty good about managing my comment section right now since we're a baby team, so that's probably my favorite thing, responding to all of you individually. I promise I read all your comments, and the second that I can respond, I will. Do you have to be a great communicator or really good with words to pursue psychiatry? I'd like to say that your communication style and your active listening skills will improve as your training progresses. However, it has to be something you definitely prioritize. It would be helpful, like I've mentioned in other videos, to often ask for feedback. If there is a different way that I could have phrased it for this particular patient, or in general, is there multiple ways to ask this question that would get me the answer I need to better treat the patient, or is there another way to make the patient feel more comfortable so that it's a little bit more conversational? A lot of the communication skills that you're going to learn in medical school are really what questions you ask, so there's definitely a script. As you progress in training in psychiatry residency and or fellowship, it is normal for you to not feel comfortable or super confident in your communication skills yet. Since you haven't learned how to do anything, you wouldn't even be expected to know what questions to ask. So really the nuances of how you conduct an interview will grow through time, and you'll learn from other people you're observing, as well as every single interview that you conduct. I read that psychologists are mainly the ones who talk and have therapy sessions with patients, while psychiatrists are more on diagnosis. It really depends on what kind of psychologist you are, as well as what setting you work in. If you're a psychiatrist that was hired for the evaluation and diagnosis, then of course you would likely be doing evaluations and not necessarily taking on cases. There's a lot of utility in families coming to you and clarifying a diagnosis, say that they've had multiple diagnoses given to them in the past and they really want to see what actually might be there, so that the treatment could be a little bit more specific and appropriate. Depending again also where you're working, you might be hired more so to manage medications, and there's a therapist, which could be a psychologist or a social worker, hired as part of the team to really do a lot more of the talk therapy. For psychiatrists, talk therapy or psychotherapy is a luxury. I myself have found a job that allows me to do therapy even though it might not be every single patient. At least I have a good chunk of time to sprinkle in different parent management techniques or coping skills. I definitely have the luxury of more time per patient because I chose to stay academic. This might not be the case depending on where other psychiatrists work. So another question that I get a lot is that I want to treat mental illness and care for families that are struggling, but I don't know if I want to do medical school. Medical school is definitely necessary if you want to be a psychiatrist. The biggest difference is that you would be able to prescribe medications. Now, there are psychiatric nurse practitioners, so that's something that I think everybody should really be looking at also, and determining whether they want to do nursing school and be a nurse and then do the additional training to be a psychiatric nurse practitioner. In order to become a psychiatrist, you essentially have to complete all the things that medical school entails, even though you might have entered medical school with the idea of always wanting to be a psychiatrist. You have to do all the rotations that are necessary and then apply into psychiatry residency. It is definitely helpful if you already have an idea of what you want to do when you enter medical school, so that you can do research and that you can reach out to mentors and be very clear-cut prior to your application. But it's not necessary, and there are definitely people that enter medical school thinking that they want to apply to a certain residency program in terms of specialty and change their mind after they do a rotation. I, for one, was one of them. I always wanted to do peds. And when I did my pediatric rotation, it wasn't exactly what I thought or envisioned in my head. And then when I did psychiatry, I just basically fell in love with it, and here I am. I'm currently an undergrad student enrolled in a Bachelor of Science in Psychology, and I'm 2 semesters away from graduating. As far as education or experience I'll need to proceed onwards in my journey to becoming a psychiatrist, where should I look or go to next? That's a great question. If you're a college student or even a high school student, choosing the major isn't what I want you necessarily focusing on. I want you to focus on and choose a major that you're interested in, as long as you complete the prerequisites to apply for med school. You're totally fine. A lot of people who decide that they want to do medical school afterwards do a post-bac so that they can complete their requirements to apply to medical school. Of course, that adds years on. If you can major in something that allows you to be able to complete those things because they're part of the major, like all your science classes in preparation for applying for medical school, then it is probably the easiest route to take, and then you can minor in other things that are interesting to you. A lot of people ask me if I should do psychology, if I want to do psychiatry. I think taking some intro to psychology classes or other clinical psychology classes would be really interesting and helpful, but definitely not necessary. If you begin with the end in mind in terms of getting into medical school, reaching out to the medical schools that you envision yourself going to, that would be within reach or even closest to your family and friends, and finding out what their criteria are for application would probably be the most clarifying for you and a good start. I am 15 and I've decided to become a psychiatrist, and this video helped me a lot. Thank you. You're welcome. I'm so glad. That's really my only goal, is to be helpful. What age do you start medical school? There's no age that you have to start medical school. If you go straight from high school and then college and then enter right after college, then whatever age you graduate college, then you can start med school. It's not easy to pursue a career in psychiatry. First of all, medicine is no joke. It requires a lot of time in your studies and, most importantly, consistency. I request you to share your routine when you had thought you'd pursue medicine. Well, I believe that one day I'll be a psychiatrist. I would be seeing this text of a 16-year-old May. I love that. I hope that you do remember this tiny channel, this comment that you left, and announced to everybody that you got into medical school and finished psychiatry residency and are doing this for a living. I think you already hit it right on the head, is that consistency is probably the biggest factor in being able to pursue medicine in general and staying true to it. Being able to step back and not forget that you were a person and are a person all throughout that process, and it's a culmination of tiny little steps towards larger goals that really add up to a lot. There is this tendency to be extremely competitive and wanting to be the best, and I think that there's probably a better way to perceive this. I just wonder if we all focused on improving everything about ourselves, and I mentioned this in other videos about being able to self-reflect and list all the things that I'm not necessarily the best at, also listing the things that I think I'm pretty good at, and focusing on both throughout time. My routine essentially was staying very organized and making sure I made time for my family and friends still. I needed that personally to be able to reset and make sure that I didn't lose sight of why I was doing medicine and residency and fellowship to begin with. I think it's easy to forget when you're drowning in books and content that you need to memorize and take an exam, and so you're always being evaluated. It feels constantly like you're not amounting to anything or enough because the expectations are so high. Being able to celebrate the tiny wins and setting realistic goals for yourself is really important. And anything that you feel like may be a setback is maybe a hurdle. It could definitely be something very difficult for you personally that maybe other people surrounding you seem to be breezing through. Trust me, everybody has those, and as long as you are persistent and consistent and give yourself some grace, I think you'll be able to overcome it, and you'll be super proud when you do. I want to be a psychiatrist. How many years does it take? So in order to become a psychiatrist, you need to do college. That's usually 4 years or faster if you want to take on classes during your break. Then you also have to do medical school, which is generally 4 years. There's combined programs that shorten it to 7, and then you go on to residency. Psychiatry residency is another 4 years. If you decide to pursue child and adolescent fellowship, then you do 3 years of psychiatry residency, and you fast track and you skip the 4th year and enter child and adolescent psychiatry fellowship. The reason why that's possible is because psychiatry fellowship for child and adolescent psychiatry is 2 years. It's the only fellowship that is 2 years. All the other fellowships that exist, and I can link the ACGME website so you can take a look at which fellowships are available, are only 1 year. I also did a video of some of the fellowship options that you have after psychiatry residency, and I can link it in the eye above. Right now though, I wouldn't necessarily be too concerned about all those things. Those are decisions that you can definitely make later on in your career. I finished my internal medicine residency, but I am unsatisfied with the approach. Patient communication and daily routine in my current specialty. I decided to switch to mental health, but I'm unsure whether I'd like to work with adults or children and adolescents. Can you explain in a nutshell why you find child psychiatry more attractive or more fulfilling than adult psychiatry? I don't know if it's necessarily more attractive or fulfilling than adult psychiatry. I just really enjoy working with children and families, and so it's a good temperamental and personality fit for me. Now, what's fulfilling is going to be different for everybody. I think that sometimes I was getting frustrated with meeting adult patients and wondering, what if I met you 10, 15, 20, 30 years sooner and we addressed these maladaptive coping mechanisms, family dynamics, or your own sense of self earlier and younger when there was more time so that I could feel like we prevented a lot of distress. I really appreciate the family approach as well, and so child psychiatry is just inherently very focused on family dynamics and addressing the whole family in which the child belongs, and or addressing the community and the environment that the kid is in every day, and often that's school. So I really enjoy working with schools and finding ways for collaboration with the primary doctors and the teachers and the school counselors, and really making sure it's a team, because we're all here to support the caregivers of the child so that they can grow happy and healthy and in less distress. There's so much potential just built into children in general, and I think that way about humans in general also, but when they're tinier and they have more time, it's just natural to believe and feel like there's so much more hope to be able to make a difference in their lives because of time. Sometimes it really felt frustrating in adult psychiatry when I was getting my patients or seeing them. I could see that there had been so many years of pain that I felt could have been prevented or treated, managed differently. And even thinking about it now, it can be really painful because you never really forget those patients that you saw in adult psychiatry or in residency or in early training. There's always some that stick with you where you feel like you could have done more. So yeah, in the end, I think whatever you find most fulfilling, and that could be even specific to a diagnosis. Like some people find it very fulfilling to work with patients that struggle with early psychosis or substance use or eating disorder. Some might prefer working with transitional age youth or adolescents or even the younger kids. I know some people that really enjoy working with moms to be, and they might struggle with depression or anxiety, and you have to navigate being able to manage the pregnancy with or without certain medications, as well as the higher risk of having postpartum. That can be very fulfilling for some people, and for others, not so much. So really, the luxury of being in training and being kind of thrown around on multiple teams is actually seeing and experiencing all those things that you can find the thing that makes you excited to wake up in the morning. Hey, my family really discouraged me after I told them that I want to be a psychiatrist. They told me I'd get depressed if I try to help other people. I'll become mental, and also, it's true, does it really affect you? This one's tough. I hear this assumption quite frequently that it'll rub off on you, and that is all stigma. I don't think that other people who are in other specialties will get told that the conditions that they treat will rub off on them. Mental illness and the stigma that's associated with it is super real. I heard it when I was going through training, and people would wonder, why are you doing that? There was definitely a tone in people's voices when I would say that I was interested in psychiatry. And it's fine that they didn't want to do it. I just know that it was best for me. Like I always say, people are always going to have their opinions, but they're not living your life and making your choices. So really making sure that you're happy and fulfilled in the end is hopefully your priority. Because if you're fulfilled and enjoy your job, then most likely you will do a better job at it, regardless of what that is, medicine or no medicine. There's a lot of support to be had and also seek out when you pursue this as a job. You're obviously not alone, but depending on where you work, you could find yourself the only psychiatrist or mental health provider in the area. So that is definitely concerning. I think quite a fast route to burnout. It's likely not a sustainable situation for most people. However, I'm surrounded by many people, a very large team. At any given time, I truly never feel like I'm alone. That's been so much more apparent since the pandemic, and we're experiencing the consequences of the pandemic and all the atrocities occurring in the world right now. It's hard enough for adults to process, let alone for children, and how do families even navigate that conversation with their children is very difficult. So what I'd have to say is, I think one, it's definitely stigma that is causing people to feel like you would also become very depressed or anxious or anything else like that. But is it possible to burn out in psychiatry? Yes. Is it possible to burn out in any medical specialty? 100%. I just don't think that if you said you were going into surgery or OB-GYN or primary care, that people would say, if you're treating those conditions, then you'll end up with them too. Okay, so I've officially made it through a few of the questions, and I've only made it to about 2 months back, so clearly I have to do more of these. Let me know in the comment section below if you want me to do more of these. I, again, read all your comments and really appreciate it, and we'll try to respond individually to each and every one of you. I just noticed that there's definitely themes in the questions I get asked, and so hopefully this format was beneficial and you just like hang out with me. If you haven't already and you found this video helpful, join the team, like and subscribe, leave a comment of more of your questions and things that you want me commenting on, and I'll see you at the next video.